With 1 in every 11 Indians suffering from diabetes, With 1 in every 11 Indians suffering from diabetes, it is important to take both preventive as well as therapeutic actions to reduce the burden of the disease on any individual and the community at large. So while it is very important to concentrate on the diet, the medicine as well as physical activity for any diabetic individual, it is also necessary to take care that they follow the regime that has been given to them by their healthcare provider. One is to take their medicines on time. Secondly, if they are on insulin, to take care of their insulin storage properly. Insulin is a very sensitive protein molecule and therefore needs to be stored at the ideal temperature. It should not be freezed and therefore should be maintained at the appropriate temperature of 36 to 46 degrees Fahrenheit in a refrigerator. Diabetic people are often asked to check their blood glucose level with the help of glucometers at home. But what we often forget or do not realize is that the glucometers may erroneously be giving you wrong results, whether on the lower or the higher side. So it is very important to use a calibrated glucometer. It also becomes important that from time to time, rather at periodic intervals, you get your blood sample tested on the glucometer and with an accredited laboratory on the same day so as to ensure that your glucometer results are in close proximity to the lab report. This gives you a sort of verification or confidence that the continuous monitoring of blood glucose levels that you are doing on a day-to-day basis or maybe several times in a day is not misguiding you, but in fact helping you towards achieving better glycemic status. A common mistake that diabetics make is skip meals. That is an absolute no, because it tends to push the patient towards hypoglycemia, would start making them feel dizzy and sometimes push them towards a more severe condition which is known as hypoglycemic crisis. It is also very important that a patient who is known to be a diabetic puts in a lot of effort towards physical activity, exercises regularly and follows the exercise regime that has been suggested by their instructor. It is also important for them to get their blood glucose evaluated from the laboratory at regular intervals, along with glycosylated hemoglobin or HbA1c, which gives a comprehensive idea about the blood glucose status of the person over the previous 3 months. While being diagnosed with diabetes may be overwhelming, a routine adherence to appropriate diet, which is nutrient rich and in appropriate proportions, along with a regular dose of physical activity, will help you attain and maintain the body weight that is desirable, achieve glycemic, lipid profile and blood pressure goals which are healthy, and of course help you prevent or at least delay the complications of diabetes, which tend to involve the brain, eyes, heart, kidney, nerves and blood vessels in totality. If you have any further question, please do put in your query in the comment box. Thank you.